Okay, this is exercise 20, which deals with the anatomy of the heart. We're going to be looking at the different layers of the heart itself, as well as the chambers and the blood vessels to the heart, not the blood vessels throughout the rest of the body. The heart is obviously located in the thoracic area cavity. It's between the lungs. It does kind of point, the lower part of it, the point which is called the apex, is pointed towards the left hip. So it is like not dead center in the body. It is slightly slanted towards the left side. The size of the heart is about the size of a human fist. First, when we look at the layers of the heart wall itself, there's three layers that compose the wall. You have the epicardium, the myocardium, and the endocardium. Whenever you see epi, that's going to be the outermost layer, and endo will be the innermost layer. So the epicardium is the outermost layer. This is connective tissue. The myocardium, this is the mostly cardiac muscle. So this is the muscle that's actually doing the pumping of the heart. The endocardium is the innermost of the three layers. This picture does show the heart wall layers and also shows the pericardium, which is the connective tissue, remember, that surrounds the heart, helping to protect it, helping to reduce friction, etc. This picture does show a cross-section of the heart. It does show all the valves. It shows the chambers. The superior vena cava, the large blue vessel at the top, it is blue indicating that it is low in oxygen concentration. Red is indicating it is high in oxygen concentration. Your veins are bringing blood to the heart. Arteries are bringing blood away from the heart. The superior vena cava, so the larger blue vessel on the top, that is bringing blood from the head, the neck, the arms, the upper portion of basically from the heart area level and above. The inferior vena cava is bringing from the lower portion of the body, your legs, abdomen, the pelvic cavities, etc. So both of those are feeding into the right side of the heart. Remember, we're looking at the patient's right and left, not yours. So they both flow into the right atrium. So the chambers of the heart, the atriums are on the top, the ventricles are on the bottom. So those two feed into the right atrium. From there, the blood is going to flow through the tricuspid valve. That is the valve between the right atrium and the right ventricle. It is also known as your AV valve, which stands for atrioventricular valve. So the blood flows from the right atrium to the right ventricle. Then it will flow out through the pulmonary semilunar valve into the pulmonary trunk, which then immediately branches into the left pulmonary artery and the right pulmonary artery. This is bringing blood to the lungs. The exchange of gas will occur in the lungs where it drops off its high carbon dioxide or CO2 and it picks up in the lungs more oxygen. So when it returns to the heart from the lungs, it will be high in oxygen now. It returns to the heart by, on the left side, you've got two left pulmonary veins. On the right side, you have right pulmonary veins. Both of those combinations of veins will flow into the left atrium. It will then flow through the left atrioventricular valve, which is also known as the bicuspid valve, and it's also known as the mitral valve. So it has several different names, but that is a valve between the left atrium and the left ventricle. From the left ventricle, it will then flow through the aortic semilunar valve to the aorta, which then is the largest of your blood vessels. It is an artery. It is flowing, bringing blood from the left ventricle. The aorta wraps over on top of the right pulmonary artery. It then immediately has three branches off of it, and then it proceeds and bends down and passes on the back side of the heart and then goes down into the abdomen. You can see several other components labeled on here, such as the myocardium, epicardium. The chordae tendae are these strands that help to um, keep the valves, the tricuspid and the bicuspid valves, from the ends flowing back up into the atriums. It's positioning it for them to work properly. Essentially, you have two different circulation patterns associated with the heart. You have the pulmonary circulation. This is when the blood is flowing from the right side of the heart, goes to the lungs, and then back to the left side of the heart. Whole purpose is for the exchange to occur in the lungs, getting rid of CO2, picking up oxygen. Essentially, the right side of the heart, if you look at it, you notice the thickness of the muscle is much less as compared to the left side, because the right side only has to pump right next door to the lungs, and that's it. The other circulation pattern is a systemic circulation pattern. This is bringing blood to everywhere except for the lungs. So it has to pump as the blood comes to the left side from the lungs to the left side of the heart. It will go to the left atrium to the left ventricle. If you notice, the thickness of the muscle on the left side is much, much thicker, much stronger, because it has to be able to pump the blood from the left ventricle and get it all throughout the body, from your head all the way down to your toes. So it must be much stronger. And this is a diagram showing the two circulatory systems and how overall they work with your cardiovascular system, providing nutrients, providing oxygen, getting rid of waste products, waste gas such as CO2, to keep all the tissues living. So you can see how essentially the heart comes in, or the blood comes into the right side of the heart, goes to the lungs, back to the left side, to the rest of the body, back to the right lungs, left side body, right lungs, left side body. You do have 4 sets of valves in the heart, as I mentioned on the previous drawing where you could see it. You have 2 atrioventricular valves. This is the valves between the atriums and the ventricles. On the right side of the heart, it is the tricuspid valve. On the left side of the heart, it is the bicuspid or mitral valve. The other 2 valves are your semilunar valves. This is between the ventricle and the artery. So you have the pulmonary semilunar valve and the aortic semilunar valve. The whole purpose of the valves is to prevent backflow. You don't want, when the heart is in the relaxation stage, for blood to flow backwards. So it keeps that flow in one direction. Now the heart itself, that myocardium, that cardiac muscle, it also needs the nutrients. It needs oxygen. It needs all of the components from the blood that the blood is supplying elsewhere in the body. But it has its own little circulatory system. You're going to have branch off of the aorta called the coronary arteries, and then that's going to continue branching to feed the heart muscle itself. The cardiac veins are going to collect or drain the blood back, not from the chambers of the heart, but from the heart, its muscle itself, from the myocardium. It will drain that blood, bring it back via the coronary sinus, which will empty into the right atrium as well. This is showing the superficial view of the heart with, once again, your superior vena cava, your inferior vena cava, which flow into the right atrium. You have the pulmonary trunk, and as it branches into the left pulmonary artery and right pulmonary artery, bringing blood to the lungs. Your left pulmonary veins, your right pulmonary veins are bringing the blood from the lungs back to the left atrium. It's going to flow into the left ventricle and out the aorta. As you can see, the aorta is divided into the ascending aorta, aortic arch, which has 3 main branches off of it. On the very top, the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery.